Hello, and welcome to the orthopedic trip to Honduras. I'm Dr. Douglas Hune. I'm an orthopedic surgeon from Delta, Colorado, and I've been on this trip several times, and I kind of know how the system works, and so I'm going to make this video so that people who are new to the trip or people who want a refresher can understand what we do on our day on Saturday when we're seeing patients in the clinic. So we're going to be going over the program FormConnect, and it's on iPad only. And we're going to be taking pictures of x-rays, pictures of the patients, as well as pictures of the forms that we fill out, and maybe some videos of the patients themselves. And so I hope you enjoy this video, and it will describe to you how things work so that we'll all be prepared for the clinic.
Alright, so here's my iPad, and we're going to go over some few things, and then we'll head into FormConnect. So you can see the lower right corner is FormConnect. It's a iPad software that you have to purchase. We will have some iPads to use. If you have an iPad and want to help, you can purchase it and bring your iPad, but you'll have to do a couple things. Number one, download it before you get there, and number two, I'll send out a FormConnect file that you have to upload. I'll show you that here in a minute. So as we talk about clinic, the first thing we have to talk about is smiling. So the most important thing, and here let me get my camera going so you can see a form that we have. If you want to go over this first, that'd be great, or you can maybe pause the video and read it through. But smile, smile, smile. Most important thing is you're going through the clinic, as you're walking down the halls, you always want to smile, say buenos dias, and you'll get great responses from the Hondurans. They're wonderful people. So we'll typically have a receptionist, a medical assistant, and a doctor all working together. The receptionist will usually bring the patient in, assign them a number, and I'll go over those numbers. They'll be on sticky notes, and typically we might also have a transcriptionist in the room who will be writing down on a form. And so the form is something like this. And so here's some most important things that we need to have on the form. Obviously the name. My name is Doug Hune, but a lot of times the Hondurans have multiple last names, and so you have to write all those down. I added Stud because that would be my other name if I had one. Then we're assigned a number. So I'm being seen at the Hospital San Felipe. I'm the 30th patient, and I'm being seen for my knee, so that's my number, okay? If you don't know hip or knee, you can ask the doctor. He'll tell you. The phone number, very important you get that, because that's how we identify patients and call them in for surgery. Age is important, sex is important, and then past medical history, current medications, allergies, all those are important, but don't spend a lot of time here. You know, we don't need to know that they had a cold when they were 2 years old. But it's important that we get any pertinent things, and again, the doctor will help you with that. Then what surgery they're coming in for is, so you can say, just circle like R is right, L is left, B is bilateral. Just circle like it's the right hip, circle the R. Here for me, I'm being seen for my left knee, okay? So you got a K up there for knee, and then down here is I'm being seen for my right knee. But you can see I put a greater sign there and circled it, so it'd be right greater than left knee pain. See that? And then the other things aren't important. We'll have a space down here for notes, and so any other things that the doctor tells you, you can just jot those things down. And again, the doctor will be there to help you and guide you every step of the way. So let's go to FormConnect. So I'll open that up. So this is a patient from a prior year. And so you can see this patient was seen in Escuela. You can see it up top there, Escuela. They're the first patient, so we have EO1. She's being seen for her hip, so we would typically add in H to that as well. So first patient at Escuela, hip patient. We put in her name. See the multiple names? That's very common. So write them all down, because sometimes they'll go by one of the last names out of the three. It's confusing. Phone number, very important. The date should auto-populate. Then you have male, female, the affected hip. You just push the down bar, and that'll give you the different age. Type in the age, the different options, and then you can type down or select right, left, or bilateral. If there's any notes down here, you can write a note. That's not a problem. Go to the next page and you'll see the form. So that's the form that I showed you earlier that we're filling out. At the end of the visit, that's when you want to take a picture of the form. So you can see in this patient they wrote down some additional comments and notes down there. And the form will look more like this than the other one I showed you. And then we'll take a picture of their x-rays. So here's pictures of their x-rays there, and I'll show you how to do that as well. My only concern about this particular patient, you can see this picture right here. See that E? It should be EO1, but that sticky note should be down low, so you're not seeing it over any of the bone. Okay? So again, the doctor will be there. If you're unfortunate enough to be with Dr. Calfee, he'll need some extra help, so pay close attention to this because he won't. As a matter of fact, he probably won't even listen to this video, so it's okay if I say whatever about him. So let me go back to what, so the year right now is 2017 November. So as you come in and open up FormConnect, the most important thing right out of the gate, make sure you see bottom right, Honduras, November 2017. Select that one. Do not select any of the others. It'll totally mess things up. So everything is in that file. Let's do a patient here real quick. So here's a patient. We'll just say that it's me. And so I'm being seen, click the down arrow on Escuela. Oh, I'm sorry, I have to put the plus sign to add a new patient. Then I'm being seen at San Felipe. My patient number is SF30, right? Isn't that what we said? Yeah. And K, because I'm being seen for my knee. Then we type in the patient's name. There we go. Hospital number, not important. The phone number is very important. Make sure you type that in. It'll be a little bit different in Honduras, but that's all right. You'll figure it out, and you'll see it on the form that the person is filling out. So I am a male. My age, I shouldn't tell people. I'm actually 54. I'm being seen for my knee. If I was seen for another one, I could just select it. Okay. And then it's my which knee hurts me more? Oh, it's my right. My right knee hurts me more than my left. Okay, so then what we do is we take a picture of the patient. So you click on that box and you say use camera. The camera comes up. Well, let me flip it around. There we go. So there I am. And so I have a sticky note here with my number. I'm SF30, right? And I'm a knee. So you want to stick it right there and get a good picture of the face and the picture. So then you click the picture button. There I am right there. You say use and then you say done. So there I am in the chart. Okay. Now any other notes, you just tap in miscellaneous comments and the doctor might say range of motion of the knee is 0 to 120. So you can just type that down. Again, brief notes, and that really helps things go by. And then it should auto-populate, okay, in terms of the date. So then what we do is we go to the next screen, just press the bottom arrow, and we're going to take pictures of the x-rays. So you press on the little frames there, and I am SF30. You say use camera. And so I have an x-ray right here. And so you don't want to put the sticky note over the bone or anywhere around the bone. You want to put it away from the bone, like there. So you always see the bone in all phases. And then what you want to do is get real close so you can see the picture really close. You're not so close so you don't see the number or it's cut off or anything like that. You want to get as much bone as you can and the number all in and take a picture. Use photo, and then you click done. Upper left corner. Then I don't have a lateral film, a side film. Use camera. And then, so let's just pretend this is the lateral now. So then you put the sticky note again without occluding the bone anywhere. You try and get as close as you can to keep the number and the bone together and take a picture. Boom. Use photo and then done. So you can see we have the x-rays in there. We have the patient and some of the information in there, but then go to the third page. So let's say we're done with the patient, the doctor's already seen the patient, we're all done. Then you want to take a picture of the patient information form. Again, use camera. There's the form, and don't come way out. You want to kind of get in close so you can see the form. Come on, baby, focus. There we go. Try and blow it up as much as you can. Take a picture of it. Use photo, and done. There we go. So now we have the patient form, we have the x-rays, and you can take more x-rays, that's fine. And then the patient, there's a good looking guy. then we're sort of done with the chart. But there's still another thing that we need to do. And what that is keep track of the x-rays. So here are the x-rays with the number on it, okay? So what you do is you take the x-rays down off the view box. You then find the x-ray jacket. You write the same number on the x-ray jacket on the upper left corner. Keep it consistent. Upper left corner of the x-ray jacket. And then you put the x-rays with the sticky note in to the jacket. Then the doctor will tell you what to do with the x-rays next. Again, if you're with Dr. Calfee, he'll need some help and guidance, and there'll be another doctor in clinic to help Dr. Calfee as well as you. And so make sure you keep track of that. The other thing is the doctor has some other things that he needs to do. For example, a patient that we're going to sign up for surgery, we're going to go ahead and write his name down in the book. And so just encourage the doctor to do that so we can be consistent. Well, I hope that was a nice intro. I hope you guys understood that. We'll be there and doing a practice run on Friday night. If you need any help, ask any of us doctors. Don't choose Dr. Calfee, but choose another doctor, and we'll help you through this process through and through so you can understand it. But don't worry, it's a fun time. It can be a busy time, but a fun time. We will be there every step of the way. There's nothing for you to worry about. We're there to help you, to help us, to help keep track of these patients that we're doing. I hope this video helps, and let me know if you have any questions.